Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. We have a very special guest on today, Christine Gall. She is the Chief Nursing Officer at Collette Health. Welcome to the program.
Tom, thanks so much. Very happy to be here today.
Yes, and as I was telling you in the preview here, we go back a couple of years, and I'm so excited to have you on the program to talk about your efforts at Collette Health and talking about nurses in general. As you know, this is going to air the week of May 6th, which is National Nurses Week. So excited to give a shout out to nurses across the country through your voice.
Thanks so much. I'm really excited to join you to celebrate National Nurses Week. It is a very special week to me and my fellow nurse colleagues around the country.
Awesome. They are the glue to healthcare for sure. Tell us a little bit, as Chief Nursing Officer at Collette Health, how are you seeing virtual care transform the role of the bedside nurse, and what excites you about that evolution?
We're at a true point of acceleration in the evolution of the delivery of inpatient nursing care. Coming out of the pandemic, there are several lingering impacts that, in my opinion, have required nurse leaders to look at the delivery of care with a new lens. As I work in my role, I work with leaders in organizations across the country, and they're all evaluating where, when, and how they can introduce technology in a manner that extends the reach of the bedside nurse and strengthens their impact. So virtual care, in my mind, is an exciting opportunity to address a number of pain points. In one hand, we have an emergence of more novice nurses that are at the bedside. The average tenure of nurses is dropping. And so virtual care can support those novice nurses as they learn how to navigate complex workflows. They also, virtual nursing can allow for real-time mentorship with that more senior nurse joining the novice nurse at the bedside to assist them in, developing and honing their expertise and their assessment skills. And it truly is a team approach in addressing patients that are increasingly complex and have a variety of needs, so that novice nurse really is supported as they provide care. I also think about the fact that virtual nursing is providing a new pathway, clinical pathway for advanced nurses with expertise. I'm very worried about the fact that those nurses who began practice before the days of the electronic health record, when how you looked at patient care, I think was a little bit different, perhaps in some ways more holistic, and allowing them to be able to support the younger nurses at the bedside and share their expertise with them so that they're ultimately cultivating the next generation of nurses in a holistic way. I think virtual nursing allows for all of those things. So it's a really exciting tool and program to implement in an organization.
Yeah, very interesting and compelling for sure. So this year's National Nurses Week's theme is Nurses Make a Difference. How do you see nurses driving innovation and leadership in healthcare today, especially as you were referring to, this tech-enabled care models?
Yeah, nurses are the heart of patient care. As the largest sector of the healthcare workforce, nurses are serving as integrators, as connectors, as translators, and the advocates of care. In my career, have had the tremendous fortune to begin my career at Children's Wisconsin, which is one of the first pediatric hospitals to earn magnet designation way back in 2004. I learned to lead in that environment where shared governance and a culture where nurses were given the tools and the resources and the support to influence key decisions that impacted their work. Way back, we're going back 20 years. And today, the voice of the nurse in crafting the future of care delivery is ever important. Last week, I had the great privilege to join CNO colleagues at a conference in Nashville, and the topic of virtual care was definitely at the forefront. I was, really excited to be a part of those conversations that were occurring on the national scene. And the aim to enhance patient quality, safety, and the experience of care was relevant in every conversation. Virtual nursing and the innovation around how to implement virtual nursing is going to support nursing practices and resilience moving forward. I see nursing is a team sport, and as such, the involvement of the multidisciplinary team is so very important in developing the next generation of care delivery. So nursing is one of those key roles, and I think is very successful at working with their interdisciplinary, multidisciplinary colleagues to essentially develop that next level of innovation. So I'm really excited about a truly integrated care model that is evolving with a combination of face-to-face bedside care and virtual care and the tech-enabled technology that's going to support that.
Interesting. So we'll get into the technology side in a little bit more detailed later in the program. But let's step back a bit and let's talk about your journey. What inspired your journey? I mean, from a clinical nursing to an executive leadership, and how has that nursing foundation shaped your approach to become a healthcare strategist?
Oh, well, thanks for that question. As I mentioned earlier, I was privileged to work in a magnet designated facility early in my career. And I was surrounded by seasoned nurse leaders and scientists, advanced practice nurses. I knew really quickly when I started clinical practice that I wanted to sharpen and develop my clinical expertise. And at the same time, I wanted to learn the components of leadership. I wanted to take on a leadership role. And it has really given me a sense of pride in being a member of the nursing department. And I've carried that pride with me throughout my career. When you look at how patient care occurs, essentially every aspect of care involves a nurse at some point. And that is a responsibility that I hold in high regard. I've had incredible opportunities, endless opportunities in the profession of nursing. And I see that factor that I've been able to do so many things in so many different roles as such an area of great fortune for myself. So I've had the opportunity to take care of some of the most critically ill and complex children and their families, and that has been a tremendous honor. I've developed and led teams to implement new programs and fill real gaps in care to really address the needs and the areas of access and care delivery that there were voids in previously. I've led a team responsible for the quality integration and reporting of data for pediatric ICUs across the country and even internationally. And with the purpose, that whole aim was to look at real data and determine who was doing things best and then improve care and spread those improvements across the country for the care of critically ill children. I've sharpened a skill set in pediatric care, and that's translated it naturally into the adult care setting. So I've also worked for a regional health system and the largest health system in the country at the corporate level in patient experience. So I've had a fortunate career, and I guess I leave looking back at my career and where I am right now. I have been so very blessed to do so many different things. And I think that is one of the benefits of entering nursing. And it's something that I share with folks that are thinking about what they want to do as a career, because I think nursing is a career that can take you in virtually any direction you want to go.
Yeah, I would agree. Nursing, I tell folks all the time, and we talked offline with my nieces and future daughter-in-law. I was actually at dinner with a bunch of their friends and was talking about how important and how nursing is one of the best jobs in healthcare, if you will, and the role that they play. If you really want to make a difference in patient care, the role of the nurse is that pivotal role. Which actually leads me into my next question. Nurses often act as an emotional bridge between patients and the care teams. How does Collette Health support nurses maintaining that human connection, which is so vital in providing quality care? So, how do they maintain that human connection in a virtual setting?
Tom, I'm smiling at this question because the tagline for Collette Health is virtual care, human connection.
Oh,
You know, my, my
I did not find that out in my homework. I apologize. I should be apologizing, but I guess it worked.
so we are definitely aligned. My role as CNO is to find ways to enable nurses to extend their human touch, their compassion, their healing to all of their patients, to remove those mundane, low-level tasks that enable nurses to practice at the top of their talent, credentials, and expertise. As we evolve our technology at Collette, we are focused on designing and removing barriers that allow nurses to remain at the bedside at the top of their critical thinking expertise and engaging with their multidisciplinary teams to achieve the best possible outcomes. So, we are definitely speaking the same language. I see technology as extending and expanding the human touch, not replacing.
Oftentimes we hear, and we hear it a lot with AI. AI is going to replace me, and technology is going to replace me, but nothing replaces that human connection, other than the human itself. And the better you can do that, the greater the gratification that a patient has, or appreciation that a patient has relative to, you taking care of me, if you will. If I was the patient, it really is a differentiator in how care is delivered. You can be robotic and you just do as the script says, but that human connection is so vitally important. So let's look ahead a little bit here. Technology is certainly changing the landscape in healthcare. You mentioned it a number of times. So looking ahead, what skills or mindsets do you believe will define that next generation of nursing leaders, and especially those stepping into a hybrid and virtual first roles?
I see the next generation of nurse leaders as being true change agents. They have to be masters of change management principles because the acceleration of change in healthcare can be simply overwhelming. So being able to manage that in a way that enables teams, staff to thrive in those environments that aren't always that are ever changing, I think is a very important skill set. Also, the ability to integrate the art and the science of nursing into tomorrow's workflows is going to be important, especially as you are sprinkling in virtual workers into that workflow. The ability to develop relationships and trusting relationships with your patients and with your coworkers in a virtual setting is a skill set, and that skill set needs to be
So true.
cultivated. So that's another area that's really important. The early adopters of innovative models of care that solve top pain points is going to be another area where leaders need to focus. When do they jump in to adopt a change? Rapid cycle improvement is a part of that. You have to be able to assess very quickly when you are in an innovative environment. What do you adopt? What do you adapt if it's not working exactly well? And what do you abandon quickly so that you don't waste too much time on a process or a workflow that doesn't work? So at the heart of the hospital, the voice of the patient and the champions of the mission are the role of the next generation of nurse leaders in my mind.
Yeah, and the hospital, it's interesting because now these new models that you're referring to, hospital at home, you
Mhm.
obviously huge virtual setting, the home becoming the setting of care in an ambulatory model, right?
Mhm.
So there's so many different influences that come into play, those social determinants that come into play more so than if you were a patient sitting in the bed. You can control what happened in the room, the hospital room. You
Yeah,
can't necessarily control what's in the home.
right.
So the whole model of how do I manage this patient in that type of setting? What are your thoughts on the differing approaches and how technology helps solve that, and how nurses can best manage that?
For as long as I've been a nurse, I've heard that hospitals are going to get smaller. More patients will be shifting into the home environment or staying in their communities. And, I haven't seen that. Obviously, we've had innovations in care delivery, in medicine and in nursing that have shortened lengths of stay. It's avoided hospitalizations for patients that would have previously been hospitalized in favor of an ambulatory service. But I think today we are really at this juncture where the opportunity to keep patients at the lowest level of care is becoming real, and I think virtual care is an incredible part of that. When I look at organizations, hospitals that are discharging patients from the emergency room to home with technology enabled, wrapped around with technology and wrapped around with clinical support in the form of, let's say, a hospitalist visit. The hospitalist admits them to their home bed and develops the plan of care and then orchestrates the implementation of that care plan with either a home care nurse or a virtual nurse, and wraps around other services like phlebotomy, some mobile x-ray, etc. So these are really incredible times. In the last role that I worked in, I was working with a technology vendor who enabled ambulances to for the so these were ambulances that responded to stroke calls, and the neurologists were actually able to begin care delivery the moment the first responders arrived on scene, rather than waiting the minutes or even hours until their transport took them to the hospital. And so very important. So we are in a really evolving time. I think the integration of the use of AI is intriguing. Clearly, there will be opportunities to improve workflows to keep staff working at higher levels and remove some of those repetitive tasks that are not really value add to the clinical team, but definitely need to be done. So there's that. There's also advanced decision support. And all of these things are going to just evolve. So the care delivery that we are doing today is going to look very different even a few years from now. And I think, the point that you made at the top of the question was, this is all to benefit population health by keeping patients in their homes as independent as they possibly can, but by smartly leveraging technology and virtual services. So it's a really exciting time.
For sure, it is a transformational time for sure. So you've led at the intersection of public health, technology, nursing. What advice would you give to those nurses who want to be more involved in shaping healthcare policy, especially in today's environment, shaping healthcare policy and the digital transformation?
Yeah, well, I think very simply, we need to stay educated. We need to keep in touch with the trends, keep a finger on the pulse of where care delivery is going. As the largest portion of the healthcare workforce, nurses need to use their voices. We need to make sure that patients are inevitably and always at the center of decision making. And, a way to do that is through, advocacy, through participation in professional organizations, and participating in how policy is shaped. I was at AONL a couple of weeks back, and there was a member of the ANA was there speaking, and she spoke about the fact that our legislators are folks that come from basically all walks of life, and they can't certainly know everything about every bill that they're asked to either approve or develop. So it's up to us to really help them, give them the tools, the knowledge, and the expertise and the insights to guide them so that they have the ability to represent their constituency. So I think that engagement is really important. And I took away from that meeting that I needed to personally and professionally step up in that manner as well.
It is so important in today's environment. I think you nailed it in that not everybody does know everything. Specifically, legislatures, and I'm not trying to criticize them, but healthcare is a very unique environment, and details matter. And when we often hear about healthcare reform, I often think only two things are going to happen: payers are going to get paid less, and consumers are going to pay more. That typically is what happens in healthcare reform, and that's not the problem, right? As a matter of fact,
Right.
paying more is the problem. 40% of patients are underinsured. A huge part of that 40%, they can't get access to healthcare because they can't afford the copay. And
Right.
and so legislation is, so we need to rethink the entire model, not just on how to deliver care, but how does care get paid for in the context so that the underserved 40% of the population or more can get true access to care. So I'm with you. The advocacy that nurses can bring to the table and the education that nurses can bring to the table is crucial, in my view, relative to educating those that control the model, if you will, and how to implement true transformational change. So on a personal note, what does National Nurses Week mean to you, and how do you celebrate or reflect on this week in each year?
Now, Tom, I have a box of letters and notes from my patients and colleagues that I've kept throughout the years. And every May I pull it out, I read through and reflect on it. It just brings back memories of patient cares, the sights, the smells. It warms your heart when you think, we all have had, anybody that is taking care of patients will have had the experience where you don't think you've made a difference, but somebody randomly comes up to you years after the care's been delivered and tells you, what they remember about how you influenced them and their child. And, that to me is so very powerful. I feel I have been so fortunate to be blessed with the ability to touch the lives of others, but equally, I've been blessed with how others have touched my life and have shaped how I look at life. And, as such, there's no other profession I would rather be a part of than nursing.
Yeah. Yeah, I would agree. And I agree in the context of my mother was very much into. She wasn't a nurse. She had to take care of 6 kids. That was being a nurse enough. But the point is that she always, no matter how busy she was always had that olive branch out to help somebody that needed help. And that nurse on a 24/7 basis, the doctors come and go out of the room, but the nurse is there 24/7, and the ability to influence that person in moving that to a greater state of wellness is paramount. And I know patients, whether they're screaming or not, if you will, do appreciate the job of the nurse and how they've changed their experience in that setting. So kudos to the nurses and everyone that is wanting to explore the opportunity to engage in healthcare in any way, shape, or form. But if you're looking to make a difference in life, nursing is the career to engage in my view. We have a minute left. I'll give you the last minute to close it out.
Well, thanks, Tom. It has been such a privilege to spend this time with you to speak to and celebrate nurses during National Nurses Week. You know, we are in an incredible time of innovation, but also have a great responsibility to ensure that how we lead and shape the future of nursing care, patient care, population health, care delivery, and the smart integration of technology and new workflows. We are so we are charged with a very important responsibility. And it's something that I know across the country, as I engage with my fellow nurse leader colleagues, it's of top importance. I think that this will be the period of time when, how successfully we implement and engage in virtual care as a component of patient care delivery. That will be the yardstick of which this generation of nurse leaders is measured against. How successful have we been? And I'm up for the challenge, and I'm excited at the progress that I'm seeing across the country, and so very blessed to be a part of it.
Well, thank you. And thank you to Collette Health for wanting to celebrate National Nurses Week on the virtual shift, which plays on Healthcare Now Radio. We'll end it there. Thank you very much. Have a great day. That's today's shift. I appreciate the audience taking the time to tune in. If you missed part of today's episode, you can tune back in at the healthcarenowradio.com at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. And be sure to check out the program page at thevirtualshift.co. As well, remember to follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, TheVirtualShift. I'm Tom Foley. Until the next shift.